Hi guys, this is Dr. Nick here. Today we're going to finish our series on the sensitive imago's BRT therapy. So the last little video that I have here is more of an explanation of BRT in a little bit more detail. At the same time, just what to expect from one cycle of therapy. So I hope you enjoy and thanks for watching.
So just to go back to BRT in general, so people always ask, like, how many sessions does it take? What does it mean to do it? So in general, what it does, one cycle of BRT from the first analysis that we do is around 10 actual sessions. So that's one cycle. So it is a very intensive therapy where you have to do it back to back to back for the first 3 days, because what you're doing is you're bombarding your body with the proper frequencies for those tissues and organs so it can take those in and actually make the proper physiologic response, because some of those organs are in a pathological state or in a disharmony, and we're trying to retune them to go back into resonance or back into harmony. So the first 3 days are kind of bombarding the signal, because it won't take all the signal from the first day. In a sense, it might take only 50%. In the second day, it might hold on to 60%, and by the third day, it might hold on to 70% of the signal or information that the BRT or the therapy is giving. And then what you do is you do it every other day for the next 7 sessions. So that's how it usually works. So it's within a 3-week period, it probably takes around that much time to actually do. And then once that is done, you take physically a 2-week break minimum before rescanning a person in a more ideal situation. If we wanted to do it quicker, we would scan then 2 weeks later to see how your body has changed and see what priorities have come up in terms of seeing if, say, the microbes have lessened, or if the organs that have been weakened that need more support, if those have changed also. So it can take sometimes for especially the chronically ill, more than one cycle of BRT to see the major benefit. But therefore, just to reiterate in terms of what you can feel after BRT, is that you usually can feel more fatigued. Sometimes even the organs of elimination kind of increase, so you urinate more often. You might even have more bowel movement sometimes. Those are the main ones, and that's why you have to drink much more water than general, because we're moving things out of the body. That's the whole purpose of doing BRT, because it's working deep, deeper at the cellular level. So when you're doing that, you're pushing things out from the cell, then into the tissues, or you can think of them into the matrix, and then from there you want to get them out of your body. So we have to be mindful of that, and that's why we have to overhydrate, especially when we're doing BRT. And then also, whenever we feel we have to rest, we got to take those rests, because it can fatigue us, because the body's now trying to fight and detox. So if it's detoxing, it needs more energy to be able to do that in terms of the organs to be able to push things out. So that's what usually happens, and that's why we should be on some kind of binders when we're doing that, or make sure that our bowels are moving in order to get things out. So that's why if you're urinating more often than usual, that is a normal response too, and that's why we base it on the disease evolution table based on Dr. Reckoway, and that's how this kind of system, the sensitive imago, kind of looks at things too, as you can see from when we're going into the different. We'll show you a case here a little bit. We're going into the different homeostasis components, in a sense, in terms of how it ranks things. So that's based on the disease evolution table, where this is more of the cellular phase, this is more of the matrix phase, and then this is more of the acute or humoral phase, in a sense. So I hope that helps a little bit more in terms of understanding what can possibly happen when we're doing BRT. And again, like we said, one cycle is around 10 sessions, and then sometimes people need more than one cycle in order to see the most beneficial results. But we take it cycle by cycle. So after we do a cycle, we take some time off, and then we go back, or we do a new scan to see where our body is at in order to assess what we need next. So thanks again for watching. I hope you enjoyed, and continue to follow me so you can keep up with my new videos on the sensitive imago or other technology that I might have available at Irene Healing Solutions.